at USF. We appreciate what everybody is doing, and you know, the football team beat the Gators, and so I know a lot of people here were excited about that. Miami's a little bit difficult, but you know, they got a pretty good runway from here, not necessarily going to be facing teams that caliber, so they've got a good shot, you know, to have a really good year. And got a big game on Sunday with the Eagles coming to town with two undefeated teams with Tampa and Philly, so I'm going to be watching that for sure. But the purpose of us being here is to discuss the success that we've had with the Florida Cancer Innovation Fund and other Florida cancer initiatives as part of the University of South Florida's World Cancer Research Day Symposium. We are also going to make an announcement about the new round of applications for funding through the Florida Cancer Innovation Fund. And I'm here joined, of course, by my wife and Florida's First Lady, Casey DeSantis, who's had a huge role in advancing so much of what we've done with cancer research. We also have the Surgeon General of Florida, Dr. Joe Ladapo, Secretary of our Agency for Healthcare Administration, Siobhan Harris, Dr. Nick Panetta, University of South Florida, and Dr. Tracy Crane, University of Miami Miller School of Medicine. We have really done a lot, certainly since I've been governor, to help advance the ball when it comes to cancer research and treatment. Since 2019, we in the state of Florida have invested more than $1 billion in cancer research and treatment. And that's an increase of funding for cancer programs by 114% prior to me taking office. This year alone, Florida's committed nearly $218 million to cancer research through 3 different initiatives that are transforming how we prevent, detect, and treat this disease. Back in about a decade ago, the Florida legislature established the Florida Consortium of National Cancer Institute Centers program in 2022. That program was renamed in honor of our great First Lady, who, of course, was coming off battling breast cancer in 2021 and 2022, and she is now the namesake of that. This program, bearing her name, was fully funded this year at $127.5 million. And we really appreciate it. I know we worked very hard with Senate President Ben Albritton to make sure that we got that done. So that program directs funds to Florida's 4 hospitals that have NCI designations, and that is Moffitt here in Tampa, the Mayo Clinic in Jacksonville, UF Shands in Gainesville, and Sylvester Cancer Center in Miami. And we know a lot of them do a lot of great work, and we appreciate about that. But we're also proud of the Cancer Connect Collaborative, which was established by the First Lady. This is a national model focused on accelerating research, sharing best practices, and turning data into action. Florida's Cancer Connect Collaborative is designed to break down barriers that slow progress in the fight against cancer. And it's built on 5 guiding pillars: data, best practices, innovation, honesty, and funding. We're bringing together public and private stakeholders to reshape how cancer care is delivered in Florida. Now, through the Cancer Collaborative, we established the Cancer Connect Collaboration Research Incubator, which is now fully funded at $30 million. This incubator is designed to focus on areas of practice that are often underserved, like pediatric cancer treatment, which is only 1% of all cancer cases. Every 5 years, the collaborative identifies a specific area of focus to specialize in, and for this 5-year term, which started this year, the focus will be on pediatric cancer. So this means Florida will make a major targeted investment in pediatric cancer research at Florida's 4 children's specialty hospitals: Wolfson, Johns Hopkins, Nemours, and Nicholas. They are all eligible for multi-year grants. They're going to be able to expand clinical trials, improve treatment protocols, and advance real-world cures. And we want to make sure that we are not just funding projects, but actually achieving outcomes. Florida is home to 6% of the nation's pediatric cancer cases. We're 6.5% of the nation's population, so that would flow from there. But we have a clear path to keep more of our children cancer-free and to provide hope for families across the state. And not that any of these cancer cases are easy, but when these kids are getting cancer, it's a very tragic thing. It's very significant for the families involved, and no one wants to see these young kids suffering like this. And so if we can be the difference maker in that, we are absolutely going to do that. Now we also have the Cancer Innovation Fund. So this was established in 2023 with an initial investment of $20 million. And the philosophy behind that is, yes, we've got these NCI institutions, you have this, you have other opportunities with maybe not as much institutional leverage, but who are seeking to do good things. Some of our smaller startups, some of our rural facilities that may not necessarily get as much dollars flowing there. So the funding for this program is available only to Florida-based research institutions. We've already allocated $80 million to support 95 research projects across the state. And this year's additional funding of $60 million brings the total investment over just a couple-year period to $140 million. And so that's a real significant commitment on behalf of the people of Florida. We want to see partnerships between universities, research institutions, and healthcare facilities throughout Florida. We want to see harnessing all the collective expertise and resources to try to produce really strong outcomes. And we've had a lot of success stories, which I know the First Lady will likely talk about when she gets up here. But for my part, I'm just proud to announce that the Florida Cancer Innovation Fund this week will be accepting applications for this year's first round of funding through the Florida Cancer Innovation Fund. And so that application period will open. We will have $60 million available for the applicants. And of course, brings the total investment to this fund over $140 million. This cycle's applications will focus on research related to preventative nutrition as well as emerging medical treatment options for cancer patients. This obviously dovetails with some of the health initiatives that we're doing, led by Dr. Ladapo, the First Lady, and Lieutenant Governor Jay Collins. Research does show that about 40% of cancer cases are preventable through lifestyle changes, including nutrition. This cycle's funding prioritizes projects that seek to increase preventative practices and/or learn more about what we can do in our daily lives to prevent or limit cancer development. So as of 2022, there were more than 18 million cancer survivors in the United States. In the next 15 years, that number is expected to grow to 26 million. We need to work hand in hand with all of our partners in Florida so that we lead on cancer research and innovation. This will make difference in people's lives. And, if you think back to where we were decades ago to now, it's been huge progress that's been made. I mean, some of these things that used to be a death sentence, now, if you catch it early enough, you have great prospects. I mean, really good statistics. So that's encouraging, but we got to do more, and that's exactly why we're here today. So those applications will be, that window is open this week, and we want you to be able to use that $60 million and really focus on things that have a high impact potentially in people's lives. Okay, we're going to hear from a lot of our folks that are here today, and I will start with my better half, our great First Lady.
Thank you. Well, I'm going to be brutally honest, not one of my favorite things that I like to talk about. Dr. Panetta can attest to that, but I mean, it's just so incredibly important that we continue to do what we've done in the state of Florida to really give hope to a lot of people who are struggling or who have family members who are struggling. I'll talk a little bit about the why for me, because it goes back to a very personal story when I was in the hospital. And I remember I was getting a chemotherapy infusion, which is never enjoyable when you're hooked up to these machines and you're getting these toxic chemicals, and you have a cold cap on your head and you have gloves on your hands to prevent the neuropathy, and you're like literally sitting in an ice cube trying to watch Netflix. But it's really hard to pay attention when you're going through all of this. And I remember one of my physicians came in, and I was trying to just rationalize what in the world was going on. I'm relatively young. I have a 1, 3, and 4-year-old at home. And I'm just wondering, how did I get cancer? I had no genetic predisposition. I didn't have any significant family history. And I remember one of my physicians saying to me, it's sad. And I'm thinking to myself, well, of course it's sad. Like, he goes, no, it's sad, standard American diet. And you know, when you ever have one of those moments where something hits you like a lightning bolt and you're like, because I had thought this whole time I was doing everything right. I mean, I thought I was eating well. I thought I was exercising. But it really started to evolve for me for what is healthy? What does it mean to eat well? What does it mean to have a healthy lifestyle? And I really just kind of dove into this path into two fronts, one of which was through the Cancer Collaborative. So that was kind of the initial foray into all of this. And that started with Cancer Connect. And that was important to me at the time because, one, I wanted to make sure that people were able to access and know where the resources were, because when you get a diagnosis like this, your mind is swirling and you don't know where to go. And so to be able to have a platform to provide an avenue to find meaningful resources, I thought was really important. And then also the stories, because as I was traveling around the state and I was talking to people, you found out you weren't alone, that there's so many people. And there were stories of inspiration, quite frankly, because I met people stage 3, stage 4, stage 2, whatever, who had beat it. And I remember it being very encouraging to me when you meet somebody who's a stage 4, stage 3 cancer survivor and they're like, yeah, I can do it, you can do it too. Man, that puts you in the right mindset to be able to persevere and to fight. And I felt very privileged to be in this position, to be on the receiving end of a lot of that. And I said, man, we need to do more to be able to get that out to people who might not hear that. The other thing was I was just overwhelmed by the amount of letters that I got at the time from so many people across the state that took the time to really write some meaningful things to me. I kept every single one of them. I tried to write every single person back, but I really wanted people to feel the same sentiment that I did when I got those letters. It also led into the Cancer Collaborative that the Better Half talked about. That was a big deal, and that was really those 5 tenets that he mentioned. Data, coming to really learn more about cancer in Florida and how the government, kind of gets involved with all of this through our Agency for Healthcare Administration. There's a lag on the reporting data. So it was like a 2-year delay before we were getting a lot of this in, and we weren't doing reoccurrence data. And with the numbers skewing lower and higher, and particularly with the reoccurrence rates, I'm like, man, we need to really understand where we're going so we as a state are well positioned to be able to help, particularly if there's a certain part of the state or a certain kind of cancer. How can we best react to some of this from a government's perspective? The investment in the research, which is really important, making sure there's an ROI for the taxpayer, making sure that the quality of care is there, and investing in good outcomes for the people. Breaking down the silos of the hospital systems. It's really been, honestly, a privilege of mine to work with different entities across the state, because I tell everybody, I said, we're at war with cancer. We should all be in it together. If Hospital A has a really good procedure, then Hospital B should be able to utilize this too, and we shouldn't have competitive advantages over one over the other. We should make sure that everybody has, opportunities to be able to get that good quality of care. Innovation and new technologies, I'll talk about that. Important that opening up these application processes 3 to 4 times a year instead of waiting for the fiscal year to open up one big application window is important. Again, we're at war with cancer. We don't have time to wait for a fiscal year. We need to get in and do it now and provide avenues for investment that might not get avenues prior to all of this. And then the prevention. So I go back to my sad story with my physician, standard American diet, and really ties into what we're doing with the Florida MAHA Commission. And it goes back to that question, is what is healthy and what is in our foods? Getting off on a little bit of a tangent with MAHA, one of the things that I've really not enjoyed learning about is this practice that they have federally called generally accepted as safe. Basically, it's a loophole for corporations to be able to convene their own panel of experts, deem a substance as generally accepted as safe, and then put it into food without having to give a heads up to the FDA. And I think that there's some problems with that, especially when you're looking at all of these processed foods and you read the ingredients And half the time, if you just read the ingredients and you didn't know what was in the bag or what you wouldn't even know what it is. So I think we have to take a really hard, long look at what in the world is in our food supply. And I know that we've been working with our federal partners, and I've had personally a conversation with Secretary Kennedy about this. I mean, this is really important that we understand what it means to be healthy and what is in our food. So the idea of trying to live a healthy lifestyle led us with this first round of applications that are going to go out from the $60 million in the Innovation Fund to two main things. One is nutrition and health, to really try to prioritize and incentivize grants and funding for prevention or for treatment, or I shouldn't say treatment, for people who are battling cancer, how diet and nutrition plays a role in better outcomes and why that is so important. I remember when I got diagnosed, I had this lady, and she would send me all the time these books and letters. She's like, you need to eat broccoli and pineapple. And so, man, I was eating broccoli and pineapple like it was going out of style. I was eating it every day of the week and twice on Sunday. And but the question for me was the why. Why is this so important? Why is food medicine? Why is this helping my body? And I think that's one of the things that we really want to empower people with is, okay, so you're saying this is good. Don't just tell me eat your broccoli. Like, like my eyes would glaze over if the government came and told me to eat your broccoli, right? But eat your broccoli, and here's why it is so impactful to your health and what it does at a cellular level and how you're giving yourself a better chance. And after all, for me, it's like, I just don't want anybody to go through what I went through. As a mom of a 1-year-old, was not fun. What I put him through, not enjoyable. He's a trooper. And I just think, man, if there's something that we can do, yes, there are pharmaceutical interventions, but to get in front of it, to prevent it, to help have people have better outcomes as a result of diet and nutrition, man, that's really impactful. And it seems so simple that it might be overlooked, but it's so important. So that's one of the components of this first round of grants that are going out. And then the second portion of this, and honestly, I've had so many people come up to me and talk about this, and that is the generic drug repurposing component of this grant. And so that's specifically for things like ivermectin. So I know that that's been in the news quite a bit. It made a lot of news during COVID. Mel Gibson was on Joe Rogan's podcast, and he was talking about people that he was friends with, and they overcame stage 4 cancer. And so here's like my perspective, and I've talked to the Surgeon General about this. Like, that's generic form. I think it costs like 77 cents per pill. Is there any incentive on the part of some to want to research this when you're not guaranteed to have a big ROI, right? If you have a novel technology or a pharmaceutical and you have that monopoly and that competitive edge, well, then you're probably going to make a lot more money. If you're researching something like ivermectin that's generic, are you going to be able to, find a study that you can get the money to be able to fund it, but are you guaranteed revenue for your company going down in the future? I don't know the answer to that, but I do know that we should look at it. We should look at the benefits of it. We shouldn't just speculate and guess. We should, as the state of Florida, with over $1 billion in funding since Ron DeSantis took office for cancer, we should be looking into things that are in generic form. And do they show outcomes? And do they show hope for people who are suffering? And we're uniquely positioned to do that because we're not in it for an ROI from a corporate standpoint. We're in it for an ROI on behalf of you, the taxpayer, and you who has a family member who's suffering from cancer, and God forbid that you suffer from cancer. And so that's why I think we're uniquely positioned to be able to help people. And I'm just, honestly, I don't like talking about cancer ever. I told Dr. Panetta on more than one occasion I'd rather sit in my closet and never say the cancer word again. But I am so immensely proud of what this state has done to really step up, to try to provide hope to a lot of people, to invest in meaningful things. It's one thing to appropriate money, but it's another thing to drive outcomes, to hold yourself accountable, and to try to incentivize prevention and better treatment. So very proud of this guy for a lot of reasons, because he put up with me while I was battling cancer, but very proud of what he's done to really stand by me through the fight and to give hope to a lot of people across the state.
Joe?
All right. Good morning, everyone. Thank you very much, Casey. It's always a pleasure to hear you talk about this area and to share your passion with all of us. And it's such an interesting thing. I mean, there are at least two things I want to recognize. One is that Florida is so unique because there are a lot of, obviously, many governors out there. But we here not only have, and there are a lot of people who are very well-intentioned, lots of well-intentioned people. But what is very unique here in Florida is that we also have courageous people. So when well-intentions meet with courage, you can make wonderful things happen. And listening to Casey there. This is what we're seeing here in Florida with how we're thinking about, specifically under her leadership, how we're thinking about directing these funds that we have for cancer research, thanks to Governor DeSantis and our lawmakers here. That conversation isn't happening anywhere else. And why isn't that conversation happening anywhere else? So, we are in an ecosystem that feels normal because that's how things are. People just really become acclimated to their environments, but it's really abnormal. So, reflect for a moment on the fact that a common drink that we give young people and kids to hydrate has these petroleum-based dyes because they make the drinks look brighter, and that's better for sales. Like that is what is normal now. That's an example of what is normal now, and that's just one example. We're literally surrounded. The ecosystem reeks of that, but it feels normal because human beings are great at adjusting and acclimating to their surroundings. But it's totally abnormal, and it undermines the health of each and every one of us. Have no doubt about it. I'll share some other examples. So, I'm a physician, and most of my care at UCLA, and I sometimes go to the county health departments here to see patients, but most of my care was in the hospital. And, any doctor who's here, how many times have we walked into a patient's room and looked at that tray of food? I literally, you walk into a patient's room, you look at the tray of food, it is nothing I would ever put in my body. But yet we come around, we talk about the vitals, we talk about the patients are feeling, we talk about the plan for the day. We never talk about the fact that morning, noon, and night, they are getting these plates of stuff that most of us wouldn't eat. And that's normal. And I was part of it. And, never said, never did anything about it. And even, going to a higher altitude and looking out, the ecosystem we have now for health, it's not one that is oriented or designed to actually improve our health, because that's not where the incentives are. The incentives are very clearly with profit. And I don't say that as a good thing or a bad thing. Clearly, it's led to tremendous amounts of innovation. But what it has not led to is tremendous amounts of health. And we are certainly able to, if someone has like a cancer that we have a precision chemotherapeutic agent for, wonderful, absolutely amazing, right? Lots of attention goes to that, and thank the Lord that we have that. But, take a few steps back. How did we even get in that situation, right? How is it that, bring up something else, like electromagnetic field and electromagnetic radiation, which we're all baking in, right? And there is research out there and animal models that show harm from that, like serious and substantial disruption to our physiology, to the physiology in these animal models, like very clearly, indisputably. And there's human data too that has also demonstrated some harm. But when do our policymakers, when do our public health officials, when do those conversations happen about any of these things? Like they're not happening, right? Because it's normal for us to just accept them. And by the way, some of the research that is used to justify the safety is like funded by individuals that are funded by companies like Motorola, right? But again, these things, they're not normal, but we've just come to feel that that's just how things are, so it's normal. We're baking in an environment of abnormality that is definitely not serving our health. It's not serving our kids' health. Secretary Kennedy there is, it's just so ironic to see him fighting for everything he wants to do, he hits a wall with. And it's like he's literally fighting for the children of the people who are putting up these walls. I'll share a story about like our kids. We've got 3 boys. So one of my boys, if you give him, you know, I don't know, like, you know, Halloween, okay? You go around the neighborhood, collect candy. It's hard to not let them eat some of the candy, right? And, you know, the candy's got red 5 and blue this and all this stuff, right? All these manufactured substances. And, you know, for one of my other boys, his physiology is probably like mine. He can eat it, doesn't really make a difference. But one of my boys, my middle son, if he eats even a little bit of that stuff, I mean, you would think that someone like, you know, I don't know, like sort of pulled him out and replaced him with some like wind-up toy or something. And we, you know, we're different. And yes, there's like, again, this normalization of all this sh*T that is put into the food that we eat and our kids eat. But it's also important as part of health to recognize that there's actually a lot of, we're different. Like each one of us has our own unique physiology. And that recognition, there's very little of that. You know, you got some people who are very resistant and able to tolerate the different insults, the different chemical and radiologic insults that we experience, right? From whether it's the electromagnetic fields or, you know, or the food dyes, or whatever else. There's some people who, you know, their mitochondria, their physiology is able to tolerate it. And there's some people for whom it just throws their systems into a total tailspin. And even that recognition, like, is not there. And a major reason why it's not there is because it doesn't fit in with the current ecosystem, which is primarily, and again, it's led to lots of innovation. It's not a judgment on it, but it is a reality that it serves, its primary purpose is for profit. It is not for our health. And the keys to our health are in all of these areas. So, you know, nutrition, I mean, I'm myself, I'm blown away. And fortunately, you know, my wife had the intuition to kind of help us with our boys, and particularly my most sensitive boy. And we have him on a very strict diet, and it's like amazing. It's just, it's completely changed his behavior. And it just blows my mind that exists. And obviously he's not unique in that way. There are lots of kids like this. You know, I'm so grateful that my wife had the intuition to sort of find a way for us to navigate a better, healthier path for him. And he eats differently than my other boys, but we're trying to move everyone in general in the same direction. But there are important insights that our system is not designed to uncover. And here we have this Florida Cancer Innovation Fund, and that's the role that you know, under Casey's vision that we're aiming to fill. That's the area that we're aiming to fill. These areas that speak to health but currently are not being addressed because we just don't have a system to do it, a system that's designed to do that. You know, Casey mentioned ivermectin, for example. I mean, there's been a lot of chatter about it, and this very simple drug that happens to be very safe, by the way, as unfortunately, you know, it's been weighed down by all this politics, especially during the Biden administration and during the federal leadership, you know, that even President Trump in his first term had to deal with. But it's not only just that drug, but there are other drugs too that have promising preclinical data, don't yet have clinical data, and may not have an easy avenue for those those gaps in the clinical data to be filled because of the model that we live in. So it's really terrific that we're going to be looking at that, right? You know, we're going to be looking at alternative therapies that don't have an inherent financial model, an inherent financial sort of component for the companies, for the pharmaceutical companies to invest in. Exercise and nutrition, right? Even for people, either for the prevention of cancer or for the treatment of cancer. Merck and Pfizer are not going to be funding those studies, but in the Cancer Innovation Fund, we're interested in that. And there actually are promising clinical trial data from NIH-funded studies that show that that can actually make a difference for patients with cancer. Reducing inflammation seems to be a huge area of opportunity, again, for prevention and for treatment of cancer and lots of other conditions. So, you know, I hope that we continue to reject the normal and we, you know, pursue a path that feels righteous, that feels like we're actually, you know, aiming toward the thing that we want to improve. That opportunity is there. Thankfully, we have leadership uniquely in this state to do it, and I hope it spreads like all those minor viruses that my critics are afraid of or something. All right.
Good morning, everyone. I'm Siobhan Harris, the Secretary for the Agency for Healthcare Administration. It's an honor to join the Governor, the First Lady, the Surgeon General, and esteemed physicians for the exciting announcement this morning. I'm grateful for the Governor and the First Lady for their leadership in transforming the way Florida approaches cancer care. Their efforts have not only elevated the conversation around cancer prevention and treatment, it's inspired bold action. Through the Casey DeSantis Cancer Research Program and the Florida Cancer Connect Innovation Fund, a movement has been ignited that prioritizes innovation, data-driven solutions, and strategic investments in elevating and accelerating the good work of researchers and scientists across the state to prayerfully bring us closer to what we all hope for, answers and a cure. This year alone, millions of dollars have been awarded to institutions across the state. These awards are fueling projects that span the full spectrum of cancer care, from discovery to delivery. At Moffitt Cancer Center, scientists are designing novel precision trial protocols for pediatric and rare cancers. At the University of Central Florida, researchers are piloting MammoChat, an AI-powered support platform for women navigating breast cancer. At Mayo Clinic here in Florida, doctors are testing whether cancer-directed therapy can be safely administered in the home, offering new hope for families and individuals in North Florida. And at Nicholas Children's Hospital, a whole genome sequencing project is advancing precision medicine for children with bone cancer. And there's so much more that the Innovation Fund has been able to yield. These are not just scientific advancements, they're lifelines for families navigating the hardest chapter in their lives. We're also seeing a renewed focus on prevention, as you've heard from the First Lady and the Surgeon General and the Governor, as well as early detection, which is tremendously exciting. A part of this is, again, looking at the role of nutrition and lifestyle choices and how that plays into cancer prevention. I really am excited about that. I think millions of Floridians and Americans are just like me who just want answers. I love the First Lady's passion for all things, but in this area in particular, to just give us answers and to just know the God's honest truth, right? What is good to put in your body? What are the best things that you can do to keep yourself whole and well? And I know I scour the internet, I Google, I do all the things to try to find those answers, and it's just a clutter of information, and it's hard to sift through all of it. So to be able to have that level of investment in our state in finding those answers, giving us those strategies and solutions, those best practices, it's inspiring. And again, I'm proud to be a part of this state and to serve under this administration that cares so much about each and every one of you in ensuring that not only does our state thrive, but those in it are living well. We must also not forget the power of partnership. As a member of the Florida Cancer Connect Collaborative, I'm excited for the work that we do, the sharing of ideas, listening to those with lived experiences, and identifying gaps in what drives meaningful change. We gather not just as professionals and advocates, but as Floridians who care deeply about the health and well-being, again, of our communities. And at the heart of this mission is a shared belief that every person deserves access to hope, healing, and the very best care possible. Together, we can ensure that Florida remains a national leader in cancer care, not just in technology and treatment, but in compassion and courage. Courage for truth, courage for honesty. So as we move forward, let's carry the spirit of our governor and our great First Lady in terms of their bold, empathetic, and steadfast belief that every life in our state and in our country matters. Thank you.
Okay.
Good morning, everyone. My name is, again, for those of you who haven't met, Nick Panetta. I'm chair of the Department of Plastic Surgery at the University of South Florida, and I'm a Cancer Connect Collaborative member. So first and foremost, I just want to extend a sincere thank you to the governor, the First Lady, our Surgeon General, Dr. Ladapo, for their unwavering commitment to supporting the Cancer Collaborative and its ongoing efforts to effect positive change in how we approach cancer care and research in Florida. It's truly an honor to be blessed with the opportunity to serve on the collaborative with such amazing and forward-thinking group of individuals, and I could not be more proud of the work we've done to date. As I've mentioned previously in settings like this, vanishingly few of us, unfortunately, have not felt the impact of cancer in our lives in one way or another. And as such, we have a shared common goal in this room of improving cancer treatment and prevention outcomes. And to that end, through both the work being done by the Cancer Collaborative and research funded by the Cancer Innovation Fund, we have embraced a unique opportunity to make a substantial positive impact on multiple fronts, including cancer prevention and treatment, encouraging and embracing collective research efforts between clinicians, researchers, and importantly, innovators in biotech, and modernizing cancer data collection and analysis systems. But all that being said, maybe most importantly, the collaborative is doing all this while ensuring that the state resources being applied to these efforts are done so in a way that leads to the most efficient discovery process possible. Historically, cancer research funding mechanisms in the state have functioned through very siloed and institution-centric systems. We heard that earlier from the First Lady, that by default impart barriers to collaboration and are really exclusionary to many experts and innovators with significant potential to make meaningful contributions to cancer treatment and prevention. To address this issue since its inception, a significant focus of the collaborative has been to remove those barriers to progress and ensure that work being supported by the Cancer Innovation Fund is designed in a way that significantly increases the pace of progress in oncology research through very patient-focused lens. Later this morning, we're going to be highlighting some of the fantastic work that has already been supported by the Cancer Innovation Fund being done by experts from around the state and is taking a deep dive into the critically important area that we've heard from everybody this morning of nutrition and its role in cancer prevention and cancer biology. The observations that these researchers are making are fascinating. I hope everyone here might have an opportunity to listen in on some of their findings. It's really fascinating work. And building on this work, earlier this morning we had a great conversation centering on the importance of harnessing a better understanding of modifiable risk factors, and more specifically nutrition-related risk factors as it relates to cancer prevention. An important question we asked earlier this morning is, what are some of the specific gaps in nutrition-based prevention research that the Cancer Innovation Fund could help to address that might have an immediate public health impact? And it was exciting to see the wheels start to turn on that front and hear the really exciting thoughts on how people think we should tackle that problem. As a plastic surgeon who focuses on cancer reconstruction, I have a particular research interest in the prevention and treatment of cancer-related lymphedema. And not only has support through the Cancer Innovation Fund allowed my team to continue to expand our understanding of the potential for novel microsurgical techniques to optimize cancer treatment and outcomes and reduce the potential long-term negative impacts of cancer treatments, but it has also seeded the maturation of an important public-private partnership that is now enabling me to deliver cutting-edge robotic microsurgical procedures to patients suffering from the effects of cancer. Our institution was the first in the Southeast United States to make this technology available to patients, and it is exactly this type of evolution in knowledge and technology supported by the Cancer Innovation Fund that is really a shining example of how resources in the hands of the right people can achieve meaningful progress in the care of Floridians being treated for cancer at a pace that we really haven't previously appreciated. So the fact of the matter is that the Cancer Innovation Fund has already made significant strides towards getting critical resources in the hands of experts who are pushing the boundaries of our current fund of knowledge in cancer prevention and treatment. And we're just really getting started on that front. But that being said, as fantastic as all the progress is that we've made, it's never time to rest. We can't ever slow down on this. Our goal is always to push harder, produce quality results as fast as we possibly can, because it's really not hyperbole to say that people's lives may literally depend on the knowledge that's gained from these efforts. And on this front, I want to recommit that the collaborative is going to continue to place increased emphasis on supporting work through the Cancer Innovation Fund that can produce actionable results over a much shorter period of time that is typically associated with more traditional research funding mechanisms. So again, on behalf of the collaborative, on behalf of the researchers who have been empowered to share their intellect and positively contribute to improving cancer care, but most importantly, on behalf of the patients that will have their lives changed for the better by this work, I'm grateful for the steadfast support of these efforts. Thank you to the Governor, First Lady, and Dr. Ladapo. Thank you.
Good morning. Thank you very much. It's a pleasure to be here, and I just want to thank the First Lady and the Governor for really investing in cancer, and to hear cancer prevention and nutrition to be at the forefront. As a behavioral scientist from the University of Miami, I have spent 2 decades studying nutrition and modifiable lifestyle behaviors, and I've been fortunate to receive one of the first rounds of the Florida Innovation Funds. So I just want to share a little bit about what we're doing at the University of Miami at Sylvester Comprehensive Cancer Center. With these funds allow us to be nimble, and they allow us to be able to really study innovative things that patients care about most. One of the number one things we get asked is, what can I do to reduce my risk of cancer coming back when you're faced with that diagnosis? And so my work has really been centered on what are things people can actionably do, one of them being everybody has to eat, and so knowing how to eat and what to eat is important. So for this Florida Innovation Fund grant, we are looking at endometrial cancer. It's one of the few cancers that continues to rise across the United States. And annually, it's rising at a rate of about 1% each year, and we are seeing this impacted in younger women across the country. Obesity and metabolic dysregulation are major drivers, and many of our patients face these with endometrial cancer. And so when we started to think about what we could do, and with these metabolic dysregulation, adjusting when we eat, not just what we're eating, may actually improve metabolism and these cancer outcomes. And at a time when you're faced with this diagnosis, knowing something actionable you can do can be empowering. So we're testing whether shifting meal timing can shift the biology, actually, in endometrial cancer. So we're launching what we call affectionately as Fit Endo. This is a fasting intervention for women with endometrial cancer. And this is a clinical trial of prolonged overnight fasting, meaning you stop eating around 6 o'clock, 7 o'clock at night, and you would wait 14 hours to eat. When you do this overnight, it's actually quite sustainable and something that's scalable and people can do. So in women with low-grade endometrial cancer, we're recruiting. I love that we're trying to reach out across the state in this vision of not being in a silo. So it's Sylvester as the lead here, but we are also working with Jackson Memorial. We're also working with Advent Health, as well as Jupiter Medical Center. So we're really trying to get this science and these discoveries across the state. And the design is we're randomly assigning women who are just been diagnosed, looking at the time of biopsy to the time of surgery. And we're looking at, can we, with this prolonged overnight fasting, change these metabolic markers, not only in the blood, but also in the tissue. And we know that because of this dysregulation of metabolism, that this could be effective. So what does success look like? Success looks like I can tell these women who are facing this diagnosis, here is something actionable you can do right now, simply by changing your meal timing and when you're eating and when you stop and start. This could have an effect on actually the tumor metabolism itself before we go in and take you to surgery. So with that, I'll just wrap it up and say, I am so grateful. I am glad that I moved my family from across the country, and I chose Florida to come to expand my career because of the large investment in cancer research that the state has made. So with that, I'll wrap it up and say thank you.
Okay. And we've, the state is also looking forward, University of Miami, they're going to be making a trip to Tallahassee on October 4th. And Florida State's got to play Friday night against Virginia, and you don't count your chickens, and that's going to be an important game. But if they're able to win that, that'll probably be the biggest game we've had in state in quite some time. Miami's ranked second now, I think, and Florida State will likely move up a few slots after this weekend if they're able to win, because some teams ahead of them are playing each other. So it could be a really big deal, and then we'll just see how that works out. But it's more exciting in the fall in Florida when college football does well. We used to take that for granted. And it was like, and now it's like, man, it's been a little bit of a time before we've had anyone compete for national championship. But I think this year is going to be different. And I think we've got, I actually think we have, UCF is undefeated. USF's got a path. And then, of course, Miami, Florida State. So we're looking forward to that, and wish everybody well. Okay, do we have any questions?
First, go Noles, by the way. But a question for you and the Surgeon.
There's probably more Gator fans in the Tampa Bay area, man. Okay. All right.
So a question for you and the Surgeon General. When it comes to vaccines, since we're talking about health, any concerns about insurance still paying for some of these vaccines if they are no longer mandated? And have you found any lawmakers to sponsor legislation in this upcoming session?
Well, I'll let Joe. You wanna field that one?
The second part, I don't know where the lawmakers are. We're working on some things in the Department of Health in terms of bill language. In terms of the first part, no. It's kind of an interesting question. If we don't force people to take something, will insurance companies not pay for it? No, I don't think that that's a concern. I've heard some discussions about that. And, you look at vaccines, like different vaccines, there's data on them. I mean, insurance companies pay for, metoprolol if you have heart disease. I mean, why wouldn't they pay for, for a measles vaccine for someone who wanted? There's evidence for both of them. So I don't have any concern about that. I know we've talked about the mandates and I think we've shared our position, but it's a very simple thing. I mean, people should not be forced to put things into their body by government. I mean, government has important roles, lots of important roles, but that line ends when it comes to what you put in your body and what you put in your children's body. I mean, it's very simple. It's been treated as this complex thing, but it's very simple. And again, it's actually an extension of what we've been talking about, which is like, what is normal? No, it is not normal for someone else to tell you what you have to put in your body. That's not normal, folks. What's normal is you controlling what you put in your body, because your body is yours. That's the secret, apparently. So, yeah.
Well, I think that, some of these issues were not necessarily things that were always top of mind for me, like, growing up or whatever. I mean, I was in the Navy, like, they would stick me with needles. Like, I didn't even know what they were putting in. Just, okay, you got to get this, you got to get that. And that is what it is. And then, when we started having kids, there's just, it was just different than when I was growing up, right? I mean, because, you have things now that, like, CDC believes that, well, maybe not under the current administration, but previously, that a newborn should be jabbed with a hepatitis B, vaccine. That should be mandated. And, it's like, that's a sexually transmitted disease. Like, really? You're going to mandate that? But to me, it was like the COVID, how coercion was used in ways that were really, really detrimental, not just to people's individual right to make decisions, but also in the credibility of a lot of the people that were issuing these decrees. The fact of the matter is, you have way more people exempting now, because we have this in Florida law where you can exempt. And I think a lot of it is because it's a rebellion against the authority figures who were telling you things that you knew were not true. I mean, when they were saying that the cloth mask is going to prevent you from getting COVID, there was not a clinical trial to ever support that. And in fact, everyone had said that it didn't work up until March 20th of 2020. Then all of a sudden, everyone kind of flipped. It was like, this thing. And I was like, okay, well, where is that? Kids should be in school. We said that. The American Academy of Pediatrics initially said that. And like they got pressure from the teacher unions who wanted schools closed. So then they flipped on whether schools should be open. It was not an evidence-based judgment. It was a political judgment. You had people that wanted to say that when the MNRA shots came out, they were like, well, if you need to get it and show that you have gotten it to go to a restaurant. And now we put the kibosh on that in Florida, but that was the vision that they wanted to do. And so, and I think one of the things that I've been frustrated with seeing around the country, and I think I think it may go on in some institution in Florida, is, I think there was a girl in Indiana, she needed surgery and they wouldn't do it because she didn't take the COVID shot or get her flu shot. And I'm thinking to myself, like, how is that? I mean, are you telling me that you're going to deny this because of that? Like, I mean, it's just insane that would happen. Not being able to see a pediatrician if you don't take a hepatitis B for your 4-year-old or something. It's like you have this kind of ecosystem that's developed, which is trying to impose adverse consequences on people based on them making an individual judgment. And people say, oh, mandates, oh, you got to have all the mandates. Well, how come Britain doesn't have any? How come Sweden doesn't have any? Most provinces in Canada don't have any. Or I don't see when these people come down to Florida, I don't hear people, raising alarm about that. They obviously managed to do it because they do it on a position of information and trust rather than from a posture of coercion and dictates. So, we still haven't really come to reckoning. In Florida, we didn't necessarily, let that overtake our state, but some of the stuff that was happening in this country during that COVID era was very, very troubling. And the more that medical is seen as, being wielded to undermine your ability to make decisions for yourself, I think that the credibility of folks in that is there. So I know they're trying to rebuild trust. I mean, people like Jay Bhattacharya I work with, he's now the head of NIH. I think he's great. I think he's very evidence-based. But from where we were to where we are, there's still just a lot of work to do.
We've heard from a lot of viewers, Governor, who are concerned and quite frankly confused about how to move forward with their own families. And so I asked you, Governor, and the First Lady and Surgeon General Latipo, you are all obviously advocates of parental rights, leaders of this great state, and parents of young, even very young children. Will you share if you vaccinate your children, if you plan to continue to do so, and your reasoning behind it?
You want to take that? I know Joe would love that.
Great, one of the funny things about this job, I was a professor, like taking care of patients at UCLA and doing clinical trials, and I used to fund clinical trials before I fortunately got the call from Governor DeSantis's office. So all this media stuff is all new to me, and some of the questions are just so funny, and this idea of well, do you vaccinate? Did you take the COVID shot? And we're talking about like it. I actually don't care about sharing information about that. I really don't care at all. But I won't. And I won't because I'm not going to participate in the silly games that so much of the media chooses to partake in instead of the substantive parts of the issues. I mean, the governor just shared the fact that we have all these countries around the world, Sweden, Norway, Denmark, the United Kingdom. They don't mandate. They don't force their population and their children to take anything, actually. They don't mandate these. Like, that's a very substantive point, right? That's something to chew on, to reflect on, to comment on. But, we don't have that. Instead, we have, Governor DeSantis, are you going to be taking the next vaccine for your child? I mean, that's just silly stuff. So I'm not going to participate in that.
Well, I also think, I remember, they were trying to, ding me for not taking this MNRA booster. It's like, no, I didn't do it because it just wasn't something that I thought, was necessary. And so I made that judgment. A lot of Americans made that judgment with all these things. I would also just point out in Florida, yes, there are legacy mandates that have been in statute for quite some time. There's things that we have cleaned up with the legislators' help. I mean, for example, there had been a provision of Florida law that authorized the Surgeon General to forcibly inject people, like literally pull you off the street and start injecting you. That was in Florida law. We repealed that. He wouldn't have done that anyways. He would have resigned. I mean, I wouldn't tell him to do it, but he would not have done that. But that was in Florida law, and I'm thinking to myself, man, that's something that's really significant. But of all those legacies, you have the ability of the parents, at least with respect to the elementary and middle and high schools, to do the exemptions. And I think what we've seen since COVID is I think you've seen more and more parents opt for that in much larger numbers. And that's obviously something Joe is protecting that. But to me, I think the reason why you're seeing more is because of the lack of trust. Why do these other countries have no mandates, and then on some of the core vaccines that have been around for a long time, they have very high uptake without any mandates? And I think it's because they view it as, okay, here's a child, here's a parent, here's a physician, here's a recommended, here's why, and then parents, can make those decisions. But it's almost like on the mandates, people will say, like, if you don't mandate it, then people are not allowed to do it. Like, I've heard people, oh, well, how are anyone going to be able to survive if there's no mandates? You do it by just basically taking care of your family as you see fit and at physicians. But you'll hear these things, and Joe has made this point. It's like, he was practicing out in California. If a patient presents and he looks and he's like, okay, you know what, we need some blood pressure medication, he can do that, and that's kind of the clinical view. He doesn't say like, oh, I believe in blood pressure medication. Oh, but people will just say, oh, I just believe in vaccines. Well, it's not a question of belief. It's a question of someone presents and then what is medically something to do. And so it really should be based on evidence and fact. But I think the coercion has been a total boomerang. I mean, what they tried to do with the COVID, it wasn't for Florida. I mean, you would have seen a lot more of this take hold around the country. I mean, we were really the bulwark. In fact, they were going to do federal vaccine COVID passports. Fauci was pushing it. Biden was basically, I think, open to it. But, some of his advisors pointed out, and this was reported, if you do that, the governor of Florida is going to fillet you for trying to do this. And I would have, because it's just not right. And now we're in a situation where I think that the amount of people that do the COVID boosters is very low. The number of parents that do it for kids is very low. And it's because they've looked at the data, they've talked to folks, and they've decided that there's not an obvious benefit from doing it. So, but yeah, I think Joe was writing in March of 2020 that lockdowns were a mistake. There were not anybody, really, very few were willing to say that at that time. And then he said, kids need to be in school in person. And as somebody that got that done in Florida, I can tell you that was not very popular either in those early days, of COVID. He also said they're not doing a good job treating it, and they didn't do a very good job treating it in many parts of the country, with the ventilators and how they did it. And then he talked about how we shouldn't have mandates and we shouldn't have vaccines. So all those things that he was doing during that time were roundly criticized, particularly by the media. But, all those, he's been vindicated on. And so I think that, what you want is somebody that's looking at evidence, that they're not just doing narratives, and that they're going to govern accordingly. But I think he has a very strong view that, his profession should not be used in a coercive way, that it's really about lifting people up. And so I think you see that in the different things that he's advocated for.
And for Dr. Latipo, what is your connection to the President and Department of Health connection between Tylenol and autism? And is there any efforts or planned efforts to make any changes here in Florida?
Oh, that is above my pay grade, but if do you want to take that one? Well, you don't have. I think, is it safe to say that you could put out some, I don't know, I mean, you'll put out guidance if there's a need to, right?
Yeah, I really appreciate what they're doing, and, it's messy. It's not one of these things that.
Can you go to the mic? Thank you.
So, yeah, I really appreciate what Senator Kennedy's doing, and, you know, Dr. Jay Bhattacharya, who worked with the governor previously, Dr. Marty McCary at the FDA, Dr. Oz also. Again, there you have the merger of good intentions and courage. And, you know, the data are messy. I've looked at it some with acetaminophen and pregnancy. But again, I think they are at a place that is more honest. They acknowledge that not all the studies show harms, but some of them do show a relationship. And it's not it's not a total explanation for autism by any means, but it does appear to be that it's reasonable to conclude that it may be contributing to the prevalence of autism in children. So, you know, not all the studies find that, but some of the studies do find that, and some of those studies are very good. So I think that their recommendation is the right place to be in terms of discouraging its use. Also, you know, it's more nuanced than how the media has presented it. The FDA has stated that these decisions should be made with the physician and the pregnant woman. But, you know, so so there is allowance for use of it, because fever in pregnant women is also dangerous. But it does seem that almost certainly there are opportunities where the medication doesn't need to be used and could be avoided.
What's your guidance to Floridians when it comes to that, as a physician?
I think if we're still looking at it, so we may have some more guidance, but it would probably be very much in line with where the FDA is.
And let me just, so bring it kind of back to what we're doing with cancer, just in terms of, because I think Joe made some very important points. The modern medical machinery in this country, with a lot of the big companies, they're private companies, right? So their job, if they're going to put capital on the line, they're doing that because they're trying to get a return on that investment. And many of them are publicly traded, and so that's what they have to do for shareholders. There's nothing wrong with that. That's kind of how capitalism works. But the reality with that is that is not going to lead to them pursuing investments on things that may not quite be as promising sometimes. So what we're doing, and some of the things with the Innovation Fund, is we're not concerned about monetizing on the back end. We're just concerned about being able to provide some capital, be able to do the research, be able to get some answers that can maybe use to help people. Not gonna make money on the back end of that, and I think that serves a needed purpose here. And I know some of the things with like generics and all this stuff. Like we want to provide the grants. We want people to do their thing, and if there's some stuff that can be helpful from that, that's great. All right, thanks everybody.